Hi there, my name is Rebecca Root and I am a reporter and senior associate with Devex. And today we're here to discuss reproductive health, the empowerment of women, and gender equality. But before we dive into a conversation about where we are now with Dr. Julitta Onabanjo, who is the Director of the Technical Division for the United Nations Population Fund for East and Southern Africa, I want to look back at the landmark International Conference on Population and Development, which happened 25 years ago in Cairo. There, representatives of 179 governments adopted what they called the ICPD Programme of Action, which recognised reproductive health and the empowerment of women and gender equality really as key pillars to sustainable development. Let's see what happened.
Just 25 years ago, it was recognized that fulfilling the rights of women and girls lies at the heart of sustainable development. This global consensus was reached by 179 governments at the groundbreaking International Conference on Population and Development in Cairo. Governments recognize that unless women have control over their own sexual and reproductive health, real progress will not be made. Yet while advancements have been remarkable since then, in many countries they have been slow and uneven. At the Nairobi Summit 25 years later, we celebrated a unique opportunity to build on the momentum of the ICPD, progress in East and Southern Africa. In the past 25 years, East and Southern Africa has witnessed huge progress in 4 transformational results: ending unmet need for contraception, ending preventable maternal deaths, ending gender-based violence and harmful practices, and ending sexual transmission of HIV. Countries have been working hard to fulfill the promise of the ICPD agenda, and together we need to work even harder to accelerate progress. By giving women equal opportunities and the freedom to control their own bodies, and by ensuring universal access to sexual and reproductive health and rights, we can make sure no one is left behind. It is time to accelerate action to deliver on the promise that we made to women and girls 25 years ago. We owe this to our young people now.
So, Dr. Julitta, welcome. Up until recently, you were the Regional Director for UNFPA SRO, and so I want to ask, while it's clear from the video we've just seen that there are still some major gaps when it comes to fulfilling the rights of women and girls, what progress have you personally seen since that conference all those years ago?
In 2019, we had an opportunity to actually reflect back on the ICPD Programme of Action and take stock as to where we had actually reached in terms of the progress and the commitments that had been made 25 years in Cairo, really. And that whole year gave us an opportunity to celebrate progress. And some of the key sort of areas of progress included the ability of women to have safe births and pregnancies, to be able to make decisions. And I think that was really fundamental in the shift at ICPD, that women would have the ability to decide about how many children they want, when to have children, etc. And I think that decision-making ability, we saw there had been such progress in it. We saw progress in the fact that, particularly in East and Southern Africa, women who wanted to plan their pregnancies actually had the means to do so, but also that children who had been put into marriage forcefully in terms of early marriage or had been subjected to female genital mutilation, we were seeing those incidences decrease. And specifically for Eastern and Southern Africa, which had been really where the toll of HIV epidemic had hit both livelihoods and lives. We were seeing a reduction in AIDS-related deaths, for example, more people getting access to ARTs. And so really there has been progress. I feel where we sit at now is that progress is uneven, and across the world, different regions have progressed in different things, in different aspects of the program of action. And clearly for us, if we still have 800 women dying every day from a preventable cause of pregnancy and childbirth, that is just one too many. And so really the agenda is still unfinished and we have a lot of way to go.
You say that the agenda is unfinished, and I know that that's true, but are there any specific areas that you just think haven't been adequately addressed at all?
Yes, I feel that it's clear to us that while we've made progress, for example, in access to service, issues of quality and equity of care still need to be unpacked and undressed. A lot of people are still not getting the quality, and particularly young people are not getting the type of quality of care that they deserve and that is of rights to them. You know, the ICPD program action talked about a comprehensive package of sexual and reproductive health services, including through the life course of an individual. So it's things like, you know, infertility, reproductive health cancers, issues around post-abortion care and safe abortion, issues around, so, you know, menstrual health. And in East and Southern Africa, you know, we know that a lot of girls don't go to school when they have their periods. And so this whole notion around period shaming, stigma, poverty are issues that still need to be addressed. And I think also what is clear to us is that while the agenda indeed as visioned and envisioned is unfinished, there are new emerging areas that potentially are really putting us still in a situation where we have a lot of work still to do. And I can give you really two major examples. Within the context of female genital mutilation, there's a shift towards medicalization of that. So that's a new thing that we're now trying to address and look at. Climate crisis has put a whole new spin on how it impacts sexual and reproductive health. And so heat stress in the context of pregnancy and childbirth is bringing us real complications. Technology, in as much as it's advanced and helped us move the agenda, we are now seeing technology-related gender-based violence, what we call digital violence. And populations have changed structures. So while Africa has a very youthful population, in Asia and the Pacific, the aging population and particularly the sexual health of the older woman, the woman that's in menopause, those are some of these really, I think, emerging issues, and also definitely on our continent in Africa with many more crises, whether they're emergency humanitarian, conflict related, you know, just really picking up things like mental health within the context and psychosocial support within the context of the response there. So really, 25 years, the picture is very different for the world and also for sexual and reproductive health. And so the agenda not only has unfinished business, but has frontier issues and emerging issues that we need to address. And I think that keeps us busy.
Yeah, I'm sure it very much does. And yeah, thank you for raising that point. I hadn't really thought about that. You think that the issues around women's rights and sexual and reproductive health are age old. You don't think that there could be new issues coming to the fore, all these, for this far down the line. But so that's a great point. And I wonder if, so I wanted to ask you about COVID-19. Is that an emerging issue that's changed the landscape as well?
Totally. I think COVID, what it did was really, I think, challenged us because where we thought that we just had to find sort of the underlying causes of some of these really important, particularly gender-related issues, we had really, addressed, at least, tried to address. I think COVID just exposed, what was a crack line was now a fissure in terms of really where we were going and really how the world responds to that. And so for us, UNFPA very early in the pandemic, the COVID pandemic, projected what the disruptions of service would mean in terms of women getting access, for example, to their contraceptive services, what it meant to women not being able to get to a facility to deliver, what it meant for practices that we thought had been addressed now resurfacing, whether it was child marriage because of economic cost that COVID implied. But I think what COVID also did, and I think UNFPA was very fast to not only project what the impact was, but to begin to change its way of delivering services and look for innovative, adaptive ways to really get services into the hands of their people and really those most vulnerable in terms of the last mile. And it showed us that we could do that. And I think, we looked at the COVID pandemic as an opportunity to really again engage with our governments to make sure they understand that this is essential health services that women need and they deserve. That gender-based violence really was a significant issue, especially when a system or a community goes through shocks and crises, that young people could still be useful in terms of addressing that frontline health workers needed to be protected. And so we got PPE kits to them so that they could actually go out reaching into the doorsteps of homes and meet population groups where they are at. So I think to us, we saw it really as an opportunity to continue to push for proper services and gender issues for our population groups.
Yeah, that's great to hear. And aside from COVID-19, which sounds like it kind of put a massive roadblock in the way, are there other barriers that you think are really preventing the world from achieving Sustainable Development Goal 5, which is on gender equality?
Yes, I think the barriers present in different forms, in different regions, etc. But I think one of the most fundamental one is this denial of the woman's ability to make a decision about who she is, where she wants to go, what her potential is, to make a decision and have the power and the means to actually, consent, for example, to sex, for her ability to decide who she wants to marry, if she wants to marry, for her ability to, and we have this year, UNFPA launched its State of the World Population Report, My Body is My Own, which spoke about bodily autonomy and really this notion around really women's rights to decide about their body and decisions around their sexual and reproductive health. And I think fundamentally, if we can address that, and that is, of course, rooted in all sorts of power dynamics in East and Southern Africa for us, it's the whole social norm construct, it's the issues of patriarchy, it's the issues of cultural barriers that still put women in a very compromising and sophisticated roles. And until we can reach that and really address that fundamental root cause, I think we still are just, scratching the surface. So I think that would be fundamentally the barrier that we need to really tackle.
And I know that a top concern for UNFPA in this unfinished agenda is redressing the deep inequalities and gaps that remain among and within countries in fulfilling sexual and reproductive health and rights for all. How do you think that can be done? I mean, it sounds like a very tall order.
It is. And I think the fundamental thing is actually rooted in data. I think first and foremost, we really need to find where these gaps and inequalities are. And data provides that really essential tool to look at evidence, to track population groups. And UNFPA is a strong data agency that uses a number of population data sets, whether there's civil registration and vital statistics, censuses. And now with technology, we're looking at georeference and geospatial data to really identify that inequity. Who's getting access to service, who's not, where are vulnerable population groups, and therefore how can we then really go to where they are and program for them. So I think that's one of the most fundamental ways in which we can address that. The other, I think, is really this notion of empowerment of individuals as their right holders, so that they really understand what is it that they're entitled to. What are their rights and what can they do to be able to address that and hold particularly those who made those lovely commitments to them accountable for that. So really that's, that empowerment of the individual as a right holder. The community, clearly our ability to sensitize communities to some of these inequalities and issues that exist. And I think at the most, at the level of leadership, one of the things that we did in Nairobi when we reviewed 25 years of progress was look really at that political commitment and the financial commitment and how much it had actually translated into actions and programs. So really that sort of thinking and really providing, political leaders with smart investments that they can make would really begin to help us address those gaps. And one of the strongest investments we feel that's a smart and best buy for our ability to develop and ensure rights is actually the investment in young people. Because especially on the continent, we feel that human capital, if investments are made, it allows economies to grow. It allows change in mindsets to happen and definitely ensures what we're looking for in the Sustainable Development Goals.
And aside from investing in young people, are there any other interventions that you would consider to be the most effective?
They are quite a bit in a lot of research. UNFPA, and in my new role as technical director, we've been looking, at evidence-based approaches that really work. And there's a whole platform of them that we call high impact investments and interventions. Family planning is another one, that if one invests in family planning along the whole cycle, from the demand to the ability to get the contraceptive to the last mile and into the hands of the user. So I think those are good, but more sort of broader issues, the issue of integration. I think, sometimes a lot of services are delivered in very parallel systems. So a woman would have to go to one health facility to get this and another to do her child health care. And so integrating reproductive health and sexual and reproductive health services, together is one of those, I think, effective ways of delivering service. Partnerships, fantastic. We have to work on that. It's hard at the start, but the effectiveness in the longer term, and the sustainability of everybody getting together and bringing their piece in a coordinated manner is fundamental, especially with private sector these days. And I think just this building of human capital and capabilities and that investment in resilience and in capacity and skills is a long-term sustainable approach that we need to be looking at.
Absolutely. And from your time as regional director, are there any lessons that you've learned that might be useful to other organizations also working to tackle the similar issues?
Yes, I feel that fundamentally it's about really advocacy, persistence, optimism, that indeed it takes time, but you have to keep on going. I think the second lesson for me has been really don't make assumptions of and FGM is a good example where you think you've really addressed the issue by, for example, addressing whether it's men that want women to be circumcised, and it helps in any way their sexual pleasures or their subjugation of women. And indeed, it's actually sometimes it's the women in the society who take this as their custodian right to ensure their daughters are circumcised. And so your programming can't afford to have preconceived ideas, and really that notion of really exploring what exactly is going on and listening in that sense. And I also feel a lesson learned is that, global solidarity is so key in global movements. And that's why for us, ICPD and the stakeholders that came together in Nairobi was fascinating in terms of the movement on sexual and reproductive health and rights. And we see that in COVID when we talk about vaccines and what global solidarity has really done to begin to redress some of those inequities. So I think those are some of the more broader lessons that one learns that really apply to us on our ability to really ensure that, contraceptives get to women, women can decide. We protect people against gender-based violence and harmful practices, etc.
And as your time as regional director, are there any personal stories that have really stuck with you?
Oh, they are so many. From, one of the things that I really tried to do was to ensure that I can engage with communities. And, I remember this one young girl, she was probably about 13, that was sitting on a bed in a hospital in Binchu in South Sudan, looking, and we came in, and I came in and I went to her and I said, what's she doing in this ward? Because this is a gynecological ward. And she had come in for a repair of a fistula. The fistula is really, again, a reproductive tract disability. And it couldn't be that she had, and usually it's typically because of an obstructed labor. So it was clear she wasn't getting that from there. And it was, well, it's not clear because indeed 13-year-olds in some communities are pregnant and have had their first babies, but she hadn't. And hers was related to trauma. So she had been violated, and at 13. But what was good was that we had trained doctors, and in fact, there was a South-South exchange of doctors from other parts of the continent who repair fistulas, and in this case, it was actually from Nigeria, going to South Sudan to train other doctors as to how to repair some of these. And this is a community that's really far from the hidden tracks. And it was really, to me, a story of hope and really a reflection of what UNFPA does best in terms of really going that last mile to ensure that, a young girl's life could be turned around by a repair of a fistula, which clearly she had been violated. And that it was going to be a comprehensive, because in that same setup, we had trained nurses to do psychosocial support, and we continue to follow up on people like that. So but there were many stories from, Cabo Delgado and young girls that were fleeing from conflict in the north of Mozambique, but we always looked for the hope that we were bringing into their lives. And I think this is what UNFPA does best, ensures dignity, supports, and really transforms lives in amazing ways. So,
yeah, thank you for sharing that with us. And finally, just 9 years out of the 2030 deadline for the Sustainable Development Agenda, what would your call to action be for the development community about how to keep pushing for the empowerment of women and gender equality?
Our call is very loud and clear. In fact, UNFPA, we have the saying, the march continues. And so it's really continuing to push to put women's lives right in the center of development, to look at gender equality and to address it, to invest in sexual and reproductive health. We have a movement around universal health care and coverage. Fundamental to that movement must be what sexual and reproductive health and access to that service must be. We really want the world to ensure that no woman should die while she's giving birth, that indeed every pregnancy is planned in a specific way, and that that every girl should be protected from any form of violence, and every person indeed, and that really together, really collectively together, we really need to ensure that those commitments really translate into action, and that we accelerate it and really reach the 2030 agenda really with a community in the world that's in a different and transformed place.
Dr. Julitta, thank you so much for joining us and for sharing your insights with us. Now, before we go, we have a few words from the new Regional Director for UNFPA-ASR, Dr. Julitta Onabanjo. So give this a listen.
I have always focused on one thing that drives me, that gives me the passion for the work, is that our work focuses on averting morbidity and mortality of women and girls, and ensuring that they get a good quality of life and well-being. Now, the result of that is if someone is healthy, is not sick, if someone is well, they usually work. They develop themselves, they develop their families, they develop their communities, and eventually the nation. So really getting that as a clear picture of what our work does helps me to focus. So if you look at the UNFPA mandate, at our focus, especially if you look at the next decade, the three transformative results speak to that. Zero maternal death, zero harmful practices, FGM, early child marriage, all those lead either to death or to morbidity. So really our work focuses on that. So that really fits in well with my passion, with my emotion, what wakes me up every day. If you look at UNFPA's strategic plan over the next 4 years, it says, yes, we have been doing this, but we need to accelerate. And we have even put in our strategic plan what we call accelerators. We have to use technology, digital technology. We have to start looking at how have countries done well and others not. Can we share practices? Who are those that we have left behind? You find it is in humanitarian settings. And so we have to look at humanitarian settings. How do we ensure that in these settings we build resilience? We look at how can we use technology, for example, to help women access family planning even in humanitarian settings. So it's really looking at accelerating in the next 10 years compared to the 30 years where we have achieved results, but in 10 years we need to do better. So that's really how I see the situation. And I think if we put our hands together, I've been speaking to the reps, to other countries, I think we can achieve results. I'm confident.
Thank you both so much for your thoughts, and thank you at home for watching.